hand you over to Dr. Merriman, a wife, a mother, a dentist, a resident of New Jersey. She's going to share her poetry, which chronicles her journey to becoming, in her words, tethered. Over to you, Sunita.
Hello, everybody around the world. I am so grateful that we get to share this time together. And I'd like to start through the filter of a poet. We are in crisis. We are in change. And it's a painful change. The uncertainty of our futures, globally, countries, communities, families, and individuals. We are all shaken to the core. But we have seen such challenges before. And I believe that if we are tethered to ourself, we can then have others tether to us. So starting with this poem, a short poem from my collection, which I thought was very appropriate for today. It's called Debris. The storm has now passed, but its fury has taken its toll. The debris spreads for miles on end. The beach lies in shocked silence, home now to the washed up destruction. The inky sky, a witness to this ruination, grief-stricken in its stillness. I plead with the dawn, can you wait in the wings a little bit longer while I make peace with this night? Call off relief and assistance. Cleanup and rebuild can wait. For now, just let the fading darkness hold me. Tovah, Rose, and myself are here to hold you by sharing the story of vulnerability. I didn't know I was broken. I was a very high functioning member of society. Things on the outside and probably to the superficial to deep layers of my inside seemed pretty okay. I had done what I was told to do, which was go to school. I had met the man of my dreams. I had 2 beautiful children. But I always knew from a very young age that there was something not right. But I, as I said, did what I was supposed to do. I achieved. I was a compliant kind of person. I was very strong, and things were happening the way I had planned them to happen. Of course, with all the breaks and the challenges and the failures that come along. But like many of us that seek help, there's usually a precipitation of that feeling that things are not right, that nagging sensation somewhere deep down. And my case was no different. And if we look back, it's usually relationships that cause us to seek help. That was where I started. When I started ISTDP, I didn't know my I from the elbow. Forget ISTDP. What was that? And it wasn't important. All I wanted to do was to have someone else take away my pain. And that's pretty much how I started my journey. boy, if I had known what ISTDP was then, I should have ran, because there is no one that can take away our pain. And that's the story that I want to tell. We are the ones that can take away our pain. But it's a paradox, the way my experience has showed me. I am the one who takes away my pain, but I was unable before I got the help that I needed, which in my case was Davanloo's intensive short-term dynamic psychotherapy. So desire in itself, for me, once again, knowing mindfulness, practicing it, I'm a clinician, talking about it, teaching it, having all of this awareness did not help me to get rid of that sensation of something was broken. As I started to get into the sessions, slowly and slowly, things started to come up that I had no understanding. Where was all of this pain coming from? Where were these memory lapses of my childhood? What was it that I wasn't aware of? And that is what ISTDP is about. It is a process of great scientific precision that goes to the core of a person's suffering. And Rose, maybe I can invite you a little bit here to give just a few thoughts of yours of how you would explain this from the practitioner's side.
Well, I would suggest that we're Sherpas.
Uh-huh.
We go into that deep, dark place and we make it safe.
Uh-huh.
Does that sort of answer where you're coming from? Because it's very hard to go back. And when those memories come up, it's so important to know that you're being looked at in a loving way. And one of your poems, it doesn't come to mind at the moment, but it says, "You're here with me, you're looking into my eyes, you're present with me in all my misery."
What I have been learning, and I do feel that it's a lifelong journey to look back and continue your healing. But what I found out was what attachment is. What had happened to me that on the outside everything seemed fine, but fundamentally there was such a break in my integration. How did I experience the world? How did I respond to challenges that usually would not faze someone who did not suffer such trauma? All of that was the missing link. And if I may again use the filter of poetry to share how deep this pain goes, if I may. Hunger. No matter how full I am, I remain incessantly hungry. I can devour you for days and still be famished. This emptiness has pushed me into a life of endless wandering. Emptiness, that's the sensation. That is what was always there. I'm crazy waving frantically right here in front of your face. Do you know me? When you hold me in your arms, nothing exists but us in this closeness. Do you feel me? I'm screaming out in pain as loud as I possibly can, telling you that I'm starving. Do you hear me? I've stripped down to absolute nothing, standing here naked, scared, and exposed. Do you see me? I ache to know. Am I yours? This sense of no belonging, this sense of being detached, of floating around with no tether to anything or anyone, is what attachment and childhood trauma is. It is so painful that we need a Sherpa. We need all the support of our loved ones to be able to come back from this dark world of nothingness, of emptiness, of darkness. But I am here to say that there is a road back, not only to light and love, but to becoming the person that you were destined to be. It happens with that yearning inside. It happens with you taking a step forward and looking for that Sherpa. And then together, you can face this terrible darkness. And when I say it's scientific, there is so much research that shows that an infant is so receptive and responsive. We look at a little baby, we think that they just need to be fed, they need to be diapered and slept, and that's good. But what they truly need is a love that is not perfect, but as Winnicott says, a good enough mother or a good enough caregiver, so that when there is a need, it is answered. I love the term that the still face experiment, Rose, I'm trying to remember, Ed Tronick, Dr.
Yep.
Tronick. He was actually the keynote at the IEDTA Boston conference this fall. So the good, the bad, and the ugly. And in my understanding, let me explain. The good is where the primary caregiver, or two primary caregivers or three, whatever your situation is, but let's take the mother as an example, is in tune with the baby emotionally and can understand and respond when that baby is in distress. It's not going to happen 100% because this is a human being. A mother is not perfection, neither does she need to be. But it's a human being that is going to fail, but can, by and large, respond to the baby's needs. The bad is when that's not happening a fair amount, but there is the possibility of repair. And what that means is the baby has a need, there's distress, the mother for some time has not been able to respond for whatever reason, but can come back, and that attachment, that bond is again repaired. The ugly is ugly. And that's when this bond is broken, it's damaged, it's traumatized, and it is so deeply impacting the development of this infant, child, and then adult, that never goes away until there is an interception. And that is where ISTDP came in for me. So when I was starting this work, and after a few months, the unconscious to me, obviously in so much pain, things that were so obvious, my reality was not visible to me. The amount of pain and trauma of my life and attachment in early childhood was definitely the case for me, but there were many things that compounded that. And a term for that is also complex childhood trauma. For example, one of the things that impacts any child, let alone anyone with attachment and other childhood trauma, is the death of a parent. And I suffered the loss, the sudden loss of my father when I was 6. And as I said, that was one of the things. So if that's one of the things, you can just imagine how complex things were in my inner world and my unconscious. When I accessed my unconscious, the pain rose like nobody's business. It was impossible for me to bear. And I looked and I desperately tried to find things that a patient would have shared in this journey. Being a clinician, being a curious person, and I think just in tune with the psyche, I started reading everything I could about ISTDP. Obviously, my understanding today is very different, but I could still start to get it. But I was looking for something that a patient would have written. And I do believe that that's when unconsciously I realized I am going to change this. And that's when the poetry started to come.
And you have.
The poetry started to come, and then the shame started to come. Pain I could deal with. Shame took a very long time. I would never have thought of sharing my work. First of all, of course, at that point, I didn't believe I was good enough. I didn't believe it was good enough. And that, again, is part of attachment and childhood trauma. We're never good enough. We're on a hamster wheel to be good enough so things would be just the way we wish them to be. But again, that's not reality. A girlfriend of mine who is, a very dear friend, she's my soul sister, Maria, I shared some of those poems with her, and she's like, no, you got to do it. You got to put it out there. I was still not ready to do it. But here I am. The message that I want to bring is, if you read that book of mine, you read that work, it is very painful. And my husband always says, I've read those poems once, never reading them again. I can't take it. My close friends can't take it. But I share it because that is the reality. But as you keep going, you're going to see it gets better. You have to believe that, and you have to take control of your healing. And you have to guide your Sherpa too. Sherpa does not mean this is a partnership. It could be ISTDP, it could be Dr. Sarno's work, and I'm going to come to chronic pain too, because how could the story be complete without chronic pain? No matter who is your Sherpa, your therapist, you must be the one driving this. Otherwise, the healing will be incomplete. So that is a truth that has to be told more often. Already, I'm coming from a place of being a victim. If I do not empower myself, I cannot get past this. And that's why I say you may be broken, but you are not a victim. There is a difference. Being broken is okay. I didn't ask for it. It's really nobody's fault when you think about things in a place from love and understanding, which grows as you get healthier. We're broken. We're not victims. So let's talk about chronic pain, and let's talk about Davanloo and Dr. Sarno. How does this all connect? How is it that Tovah and Rose are here now, second generation of this work from both ends? If you haven't heard of Dr. Davanloo, he is in his 90s, and Dr. Sarno passed away a few years ago, a couple of years ago in his
He was
96.
96.
Wonderful. So contemporaries, but I was watching Michael Galinsky's movie All the Rage, and he talks about 5% of Dr. Sarno's patients that need more than reading the book to deal with the chronic pain. That's where Davanloo comes in, because his patients have more than chronic pain. These are some very deep psychological issues. And from the time actually that he started his work, now that the categories of patients that ISTDP practitioners are seeing are much more diverse and much more complex in their origin of illness. And I would like to, talk about Dr. Allan Abbass's work from the Dalhousie University in Nova Scotia, a student of Dr. Davanloo's, who has taken the torch and has changed the way we look at this psychotherapy, dynamic psychotherapy, by doing research that validates it. But going back to chronic pain, now I can look back and see I was about 17 or 18, and when I go to the timeline of my trauma and repressed emotions and circumstances of my life, that's when my back pain started. I actually had to drop out of my first year of university. Extreme pain. It got better. Fast forward to when I had my first daughter, who right now she's 21. So I gave birth, new baby, a lot of changes, starting a dental practice from scratch. So much of, at that point, again, repression, totally unaware. Remember, I was healed. I was cool. Managing all of these things and many other life circumstances, my back was the one that was screaming. I had a great patient who still is my patient, anesthesiologist. I look at him and I said, okay, physical therapy is not working. It's getting worse. 2 years later, I need a solution. So he referred me to a neurologist who was a friend of his. I went to an orthopedic surgeon. I had 3 opinions, and everybody at that time, they took my CAT scan, they put it up on the screen, and every single one of them said, yep, you got herniated discs, and it's really up to you. If you want something definitive, we can't guarantee it, but surgery is the only option because physical therapy is not working. You're getting spasms, every few months, and then it became every few weeks. And when I was looking at the movie and I saw Michael in his office, laying back, that used to be me, Tovah, between patients. I had barely enough patients to see 5 people during the week, starting from scratch. And between those patients, I would tell my assistant, okay, I'm going to go lay down. And I would lay down exactly the way he had his position, laying on the floor, legs up, trying to find some spot of comfort. Had surgery. And my mind, I'm sure, said, this better work. So it did work. It did work. Years later, same thing. Same thing. Saw another surgeon. And he looked at me. He looked at my CAT scan. Same thing. Goes right up. Got all my records of surgery. And Dr. Gregory, he says, aerobic exercise, 3 to, well, actually, no, he didn't say 3 to 5. That was just me hearing it. He said every day. But every day, 30 minutes. Herniated disc, yeah, you've got them. So do millions of others. I'm not going to cut you open. I was begging him. Surgery worked before, please. He said, no. The good thing is that I was already in therapy at that time. So everything worked. So yes, hand up, had back surgery. It came back some years later, worse than before. After that, it took a while, the muscle spasm, yes. I need to be careful. I need to work out. I need to do all of that. But now that this is clear and my heart is open, I don't have back pain. So I understand what Dr. Sarno was saying. And once again, this doctor did not really make much money off me. He gave me, a prescription for some muscle relaxants and said, go work out, aerobic exercise, 30 minutes a day, do it every day. So there is such a connection. What Dr. Davanloo was doing 40, 50 years ago was he was dealing with people's psychic pain and how that spills over when we can't tolerate it, we can't take it anymore. It spills over into our bodies. It activates our sympathetic nervous system. Cortisol is released, and we're constantly feeling threat. We're constantly doing that. And what does inflammation do in our body? It creates almost every disease. It's the starting point of almost every disease that's non-communicable. So this is a cycle that is so easily explained, yet here we are having a conversation that should be a conversation that every physician should have. And that's why we are here. And that's why we're having this conversation, so that more and more people can understand what they actually know instinctively. Instinctively. The more comfortable physicians are with depression, with mental anguish that their patients come in with, a simple question of, how are you? What's going on in your life? I go even further. How was your childhood? Tell me a little bit about it, So that's the conversation that we need. And that is something that I believe in. I see it every day in my patients. What I found, there are many things that I understand much better, and I think all the time, how can I convey what I know other than in poetry? What did I come out of this journey with? What is the simplest, most fundamental, basic understanding of human nature did I come out with? And that's where self-love, self-care first comes from. Because if we don't love ourselves, we cannot care about ourselves. It'll be superficial. I'm all for a massage. I'm all for, feeling good and doing things. But the pain of our lives, the messages we receive go way deeper to debilitate us, to cause us to, at times, not pay attention, and at times, hate ourselves. It's a difficult journey, and it comes from the deepest parts of our unconscious. So self-love, self-care first is a journey of learning that I'm on, and it's going to take the rest of my life, and I may just scratch the surface. But philosophers have talked about this. They've questioned it. Buddha, religious leaders. This is the journey we are on, to find compassion for ourselves, to find acceptance, and further, to find love for ourselves. Because when we are full of love for ourselves, there is no way we can spread hatred. We then blossom. That is the way I have found love for others. And even in coronavirus, with the need, I have the role of mother, wife, doctor. My practice is closed right now. It's mandated to be closed. So I'm separated from my patients, but they are still my responsibility. I care about them. My team, we are separate. We cannot be together on a daily basis. We spend time. We are a family. I have all of these things that I think about, but then how do I control my energy? I go back fundamentally to myself and tether myself. Sometimes it's easy, sometimes it's not. I'm human. Just because I went through ISTDP does not mean that I have no worries. I deal with them differently. And that's where I go back. I go back home, and the first thing I do is what, Rose, you started with: breathe. Come back in the here and the now and breathe. Yes, it is a dark time, but we got this. We have got this. Take care of yourself first. Nourish yourself. Heal yourself. Get a Sherpa. Get 10 if you need. I needed a lot of care from my Sherpa. I was at times incapable of fighting or taking care of myself. But eventually, I had to emerge to take charge. So find that Sherpa. Ask for help. But in the end, we must empower ourselves to find that resilience. Because the world is going to look different. We don't know what it's going to look like, but it's going to be okay. And to be able to roll with that change is the healthy part of us. When we want to stay the same, have the same, be the same, that rigidity is not the healthy part. So that's what I'm here to share. You have everything you need within you. There is no question, but you must believe it. And as they say, fake it till you make it. If you don't believe it, keep saying it. Journal. Find a mirror. Get in there and say, I'm worth it. I'm entitled to feel happy. And then again, as I say, there's no value you can assign to a Sherpa who's going to be there with you. So to all the Sherpas out there, shalom. I salute you, and I want to be a Sherpa for someone else, for one, for two, for millions. I felt you when, of course, when I wrote and I write my poetry, I feel you. I feel the energy. I feel millions of people connected. So ask for help. Find your light, because we are not moving towards any light. There's no light out there. It's inside. We have to move inside, not outward, to look for the light. The light is inside. And when you find yours, you are able to light up the world.
Thank you very, very much. That was just beautiful. Can I just ask you, my first question would be, how do other people perceive you now from earlier on? When people remark about you, what do they say?
That's an interesting question. And I actually asked a very dear friend of mine. His name is Pradeep, and he was one of the few people that I had shared that I was undergoing therapy. You know, now it's common for me to just talk about it, but before it was a big secret. And these were his thoughts. He said, "You were always very clear, very strong. And the only way I really could feel the pain that you went through was reading your poetry." So, Rose, it's very interesting that many of us hide our pain so well that the closest people to us do not know. So that was the experience of many of my friends who saw me as very capable, out there, dynamic, and they had no idea of the devastation, the shambles that I was in, and the desperation. So that's how he described it.
Fantastic. Also, your capacity to reach out now. You just said a few minutes ago that, or it's how I read it, that you probably wouldn't have reached out in this sort of way. You wouldn't have talked about this stuff previously. It was all private. It was all inside. It was all part of that emptiness. Whereas now, with the light within and the love within that radiates out, you're able to share your space. Am I making sense? That sharing that space now seems to just flow from you. How can you reflect on that for a moment to share that? Because really, when people are suffering, they haven't got that space to do that. They're just surviving on a day-to-day basis. As you said, you're lying on the ground in a fetal position, trying to relieve the pain between patients. And then you get up and you do your work, and then you soak back into the pain, I suppose. Can you just talk about that difference now when that light is sort of within you? It has sort of, because I notice with patients, the light comes out from them. The room lightens up for them. They get a sense of lift when they've broken open their suffering zone. Does that?
There's a couple of things that I want to share, and thank you for this beautiful question, because it deals with shame and secrets.
Yeah, exactly.
Many of us who suffer trauma, especially childhood trauma, where we are not developed as human beings, as individuals, in all the ways that healthy development and integration happens. Many of us come from backgrounds where secrets or don't say anything is part of what we're experiencing and taught. So such pain, and to talk about it, well, actually, such pain and shame and not having an opportunity to talk about it reinforces that.
Exactly.
And ISTDP, as you know, when you are seen for who you are, not for what your experiences are, but for the best part of you, changes, you're tethered. And for me, any moment of shame at this point doesn't belong to me. And I have had to find purpose in my suffering. That purpose for me is to stand up and say, I will stand up. It doesn't matter how successful I was. It doesn't matter how sane I seemed. I was broken. And that in itself, I am hoping, is going to give someone else permission to say, phooey to this, all this outward, I've got all of this, or maybe you don't have this, or someone expects you to be a certain way. If you're broken inside, then it's not worth, nothing in this world is worth it. Someone asked me the other day, would you do this process again? And I would say, well, if I could avoid it, I certainly would. But I will tell you this. If today I was given a choice of living free for only one more moment and living with the shame, pain, brokenness that I did, and a false life, because there was no truth in me. There was nothing authentic about it, because I didn't know who I was. I would take that 1 minute, and there is no hesitation in my answer. To live free, to live whole is the goal for me. And I think it is a human instinct. It's what we desire. It's what we want. So living free, living whole, living truthfully, there is not shame, but there is honor in that, and there is courage in that, and there is bravery. And the more courageous we become, the more steps we take like that, we become fearless. I am not an anomaly. I am not special. I am not exceptional. We all have the capacity. So don't think that my story is unusual. Let's work together and make this a common story. Make this something that is just so every day. But that's how I feel. One moment of freedom is worth everything for me.
True. Tovah, have we got any questions?
No, I think that I want our community to know that they can ask questions. I think I'm looking at the right place. I'm looking on my Facebook.
Mm-hmm.
So there's an opportunity to ask questions to Sunita, Rose, or myself about anything that she's talked about, anything regarding TMS or ISTDP. And I'm not seeing any questions right now. I think I'm looking at the right place.
Would you mind actually reading? Have you got your book in front of you?
I do.
Oh, good. Okay. Because I really would love you to read. I should have written this down.
I know most of them quite well. So
Quite
if you
well.
tell the ghostwriter taught me well.
One of the
Tovah,
things.
Did you have a question of me?
No. Well, I wanted to know. I guess the question I wanted to ask was, for example, how do you feel about having back pain and having surgery, and then knowing what you know now? Do you think I should have had the surgery? Why did how are you feeling about the whole physical part of it, which is always interesting to me?
I'm going to answer that question again. Thank you for that question, because I'm going to give you two answers. One was pre-ISTDP, self-love, self-care first. What was I thinking? What was wrong with me? My gosh, how silly was that? I wouldn't have used the word silly. I would have used a little something stronger. That I went in and I just said, cut open my back. How stupid was that? But here is me today. I was in so much pain. I needed help. I did my due diligence. I did 3 consultations. I so wanted help that I willed myself to feel better. I wouldn't have had my second child. I have 2 daughters. My second child was because I was feeling better. So I'm going to say I did the best I could. Looking back, this is more educational so that I could be a Sherpa for someone else. But I did what I knew.
Mhm.
And today is a different day. But looking at things, change takes time. And Dr. Sarno spent decades of his life struggling and toiling with very little support, if any. I'm sure that he would tell of people that probably criticized him or dismissed him that came in through his back door to be helped by him. And that's the way of the world. But the change is going to happen slowly and hopefully now accelerated because of what you and Rose are doing and many others are doing. So 2 answers, I could go back and beat myself up for that, or look at it very compassionately and realistically that 17, 18 years ago, that's what I knew.
Yeah.
But I know
Exactly.
better, so I can share more and share better. And that's why I'm here today.
Wow. Do you think you could read out SOAR? Can I
would
just
love
sort of
to read.
do a little prelude to it first, though?
Sure.
SOAR, when I read SOAR, one of the things I found with your book is when patients can't move back into that internal space and they're resistant and that, I ask them to read that just as beside their beds, just read a passage. But SOAR goes to the heart of what patients are feeling, that pain, that fire within them, that burning sensation that's happening in their muscles. Needs to be burnt through and go beyond it and see what's behind it and to get to the heart. So I love it because even that opening verse, I'm still on fire, let me freely burn. Can you?
I would love to, and I'm honored that you asked me. I usually don't do this, but I'm going to share what the background of this was, if I may. My husband, Tim, and I, we've been married almost 25 years, and his love was also instrumental in pulling me through this. He does not want to see me in pain ever. And I remember being in the process, and he was trying to make me feel better. And as you know, there is no feel better. You've got to experience it. So this is for Tim. SOAR. I'm still on fire. Let me freely burn. Don't hover over me with your bucket of water. It won't be enough. It won't help me much. I'm still in agony. Let me feel all my pain. Don't wrap me up in your scanty rags. They won't be enough. They won't help me much. You've only seen the tinder burn. Let me get down to the blue blaze. I don't want a single log to escape this inferno. Just stand back and watch me brightly burn in my skin. Stay close to me, but let me writhe in my suffering. I want this bonfire of my lamentations to light up the starless sky. This conflagration will spread faster than you think. It will burn through my soul soon enough. Stay with me, but let me rise from my ashes on my own.
beautiful. We have a question. And I'm excited to meet this gentleman. This was a gentleman I told you about, Sunita. He's in Israel. I think he's a psychotherapist. Elad Jar Krohn. Anyway, he's questioned to Sunita. Would you be willing to describe some of your most transformational moments in therapy, in the sessions? What were you doing, the therapist doing, possibly what happened between you?
I will try to describe it in a way that protects these special moments, because it wasn't just one moment. First of all, thank you for joining us, and I appreciate the question. Now, remember, I'm a patient, I'm a clinician, and I'm a poet. So let's just take that into account. But the answer to that question is when our unconsciouses were one. That's when the transformation happens. That's how it happened for me, when there was no one unconscious. So I don't know how that answers the question. Rose, maybe you want to add something to this, since you're a practitioner and you have moments of transformation along with your patients, I would believe, or you see transformation, but that's the best that I can describe it. It is divine. There is no other word. It's divine.
Yeah. The unconscious is amazing, isn't it?
Amazing.
And it opens up the whole, it like opens up the universe somehow. I don't know if that's it's sort of like all that darkness or whatever within is gone, and it becomes illuminated. You know, this is why I'm holding on to my pain, because, you know, I was never listened to. This pain is calling me to listen to myself. And then all of a sudden the unconscious opens and it says, yes, you know, you weren't noticed. That attachment bond was ruptured in a way that wasn't repaired. So I think that's the best way of describing it without getting into the nitty-gritty of the feeling of anger, the rage, the sadness, the grief. I mean, we haven't touched any of that, but it's a global thing. You know, sadness, grief, anger, rage. It's all comes out in the unconscious, and the thing about it is it's freeing, and that's what's so amazing about it, to be free and to have a memory that I had a pain, but it's only a memory. And then when a pain comes up, you think, well, what am I angry about? And as soon as you recognize what you're angry about, you've forgotten the pain. Sorry, Tovah.
No, please. I love hearing. You're like a poet, Rose. Our next book. I want to answer something to Elad, because I learned this from my therapy, and I say to my patients that when you're in therapy and we're in this safe place, that's why the relationship between the therapist and the patient is so important. And I think we all understand that I'm never offended if someone doesn't want to do therapy, because it's not about me, it's the process. There's you, there's them, and there's the therapeutic process. But I feel like it's a safe place, therapy, and it's a place where you get to be very authentic. And you get to be yourself. And I say to them, say anything you want to say, behave anyway, express, because this is the way you want to be in the world. You want to take this relationship out into the world. And these are the kind of people you want to be in your life. You want to be able to talk this, you know, to be able to be open and authentic with your mother, your father. Look, they may not respond back like your therapist, but at least you're being real, you're being free. And I think that's a really important thing. And again, regarding therapy, I think it's the strong person who says, something's not right. I need a third person. I need an objective person. I think it takes such strength and courage to say, I need help. You were talking about that.
It's in that vulnerability that we find our strength, because to say I need help is the strength that we have. It is the courage to stand up and say, please help me. And I think our society is also, I hope, changing, where having everything under control, and it's a common thing. How are you doing? Oh, great. You could be ready to like jump off a bridge. No, let's be honest about what's going on, because there is no shame. We're all in the same boat. We are all human. We're all struggling. We all have joy. This is the human experience. So how is it that asking for help is shameful and is weak? No, it's much more hard to be suffering on your own. And asking for help is the courage. And then once you've had the help, and if you feel like you want to go out there and talk about it, let's do it, because that courage is the opposite of shame. So shame is here, courage is here, fearlessness is the opposite of shame. And you do have to become fearless, and it's not overnight. This did not happen overnight, and I still work on it on a daily basis. There's no therapy, there's no ISTDP, there's nothing that can take away our struggles, but how we are looking at those struggles from a place of empowerment, from a place of confidence, from a place of resourcefulness and resilience is what therapy gives you. And the ability to think that I can get through this. It may not be easy, but I got this. And if I don't have this, I can ask someone else to come help me. Not necessarily the therapy, but in life. And that's also part of attachment trauma, where you don't reach out. You don't even know how to do that. And that's also a big change, Rose, is where my relationships are much deeper, much more intimate. And also the relationships that were destructive and dysfunctional and poisonous, I'm not going to use the word toxic, it's been overused, but very poisonous, had to be let go. It's a whole world of renegotiating, rethinking, and new paths. And those people who love you take you for who you are. They celebrate your strength. And those are the ones that are your dear ones. But with that trauma, you can't differentiate. You cannot receive love. So forget about receiving, you can't give love.
Yeah, because the barrier comes up.
The barrier, and you give it to the wrong people.
Yeah.
You're handing it to the wrong people. You're desperate for connection, so you hand it to the wrong people. The ones that are right there in front of you, like this, with their love and their support, you can't see them. You're blind. So the ability to make these decisions as to who deserves my love, who deserves my efforts, are much clearer now. They're much clearer because that hunger is gone.
Well, that's right. But it goes back to that attachment originally of not being able to speak up and ask for your needs to be met. And then when that unconscious is opened and you realize what exactly you're holding back on, that's the freedom, isn't it?
It is the freedom. And it's not only the psychic pain. It's been clearly shown that childhood trauma, people that have childhood trauma have a much higher level of cancer, of depression, of suicidal tendencies, of heart disease, of physical ailments. It destroys the fabric of our entire immune system, of our responses to the environment. So this is a very serious issue in our society that we must focus on.
It's a major health issue anyway, isn't it?
It's costing our systems billions and billions of dollars as adults who have been traumatized as children go on and suffer physically, mentally, and then very likely perpetuate the same kind of trauma to their children.
Intergenerational trauma.
Yes,
Yeah.
so there is a genetic design that continuously perpetuates. But on the other hand, healing will activate that genetic material of ours, which is good and strong and resilient.
That's
And
right. Yeah.
that is a whole other discussion of why it's so important, not only to feel good and to say self-love, self-care first, but to change the trajectory of our families. And that changes the trajectory of our communities and our world.
And the next generation.
Absolutely.
The generation after.
Absolutely.
Sunita, I wanted to just chat. I think one of my patients might be watching, but I wanted to talk about this because it's very interesting. Look, it's a big thing to even understand a trauma, and even if we have a good childhood, we sometimes come out of it. And this particular patient didn't have a lot of trauma in her childhood. She couldn't think of it. It was a pretty good childhood, and that happens to many people. But she was shocked to have an injury that turned into something chronic, and then she realized what the chronicity was. Being in pain, not being in pain, because we don't know about pain. We don't understand pain. We don't understand what the fear, fight and flight mechanism in our brain's doing, which is a very simple thing. I don't understand that when I laugh, when I cry, when I think, when I ruminate, I'm affecting my hormones, I'm affecting the chemicals in my blood system. So, she had an experience where she went to a doctor, and the doctor said, this is wrong, this is wrong, this is wrong. And that put her in a state of fear. And like, you were right, you're the doctor. I don't think the doctor did anything wrong. He did his job, did an excellent job. And I think that's where Dr. Sarno and Schubiner and Dr. Schechter and Dr. Hanscom and Dr. Gabriel Matai, are maybe putting a huge shift in the universe to that. There's a book called The Patient Will See You Now, to the doctor, remember, I think the doctors just need to treat the patient, not the condition. And I think that if my patient was maybe not with such a strong-minded, this doctor, she might not have gotten into the fear. And yet with this whole big thing that happened to her, she's realizing because of this work, this was her test. This was her lesson. This was her karma. In Hebrew, we call it, this is a tikkun. This is something she'll have learned from, great lessons that she can teach her daughters to not have to go through this. So pain is a message. Pain is telling us something, and shouldn't be something that we stuff. I don't like to use the word should. And I really wish that there could be a subject in first grade, pain 101. I really wish it wasn't a voluntary subject, but something that everyone could learn. And it's simple. You don't have to be a doctor to learn about pain. It's fascinating. And I think, like Dr. Sarno says, knowledge is the key. So I think that, to review a couple of the tools, I haven't gotten a question yet, but I see some people are watching, is knowledge, journaling, which is now researched that when you write down what you feel, what you don't feel, what I wish I felt, what I hate that I felt, what I love that I felt, that I want to feel tomorrow, whatever you write down, it's researched that it affects something in my brain, in my neurological makeup, not on the computer, not speaking into a microphone. Writing down physically can help you release pressure. And there's some research, and I'm happy to send the research to anybody because I like scientifically backing up what I'm saying. Meditation, which, we used to think it was for the guys in India. And now it's about the relaxation response. It's about how can I calm my brain down with breathing and exercising sometimes through the pain. This is not dangerous. And this is also being researched. Accepting the diagnosis that your pain is psychologically based. Doesn't mean your pain is not real. And we talk about the phantom leg. The pain is real. Your body has the ability to create physical pain to protect. And sometimes, not all the time, but for some people to have gratitude and to do forgiveness are some of the tools. And if anybody wants to email me, I can send them a copy of some tools that Rose and I worked on together. So I'm not seeing any questions yet. I think it's beautiful how you shared, and it's like you captured so much. And I know a lot of people are viewing, and I think people are shy. I always try to put myself in the place of like, I know I had a question before, but I can't think of it now, so I'm just going to listen. And so I'm not seeing any questions right this minute. But Rose, you want to share something? I love this mute button. I'm going to unmute you, Rose. Yeah. Wait.
I needed to unmute myself.
There you go. Start again.
Anyone who wants to ask a question later, I'm more than happy if they write it in on Facebook. I will respond.
Yeah.
And so will I. I'm very happy to do that. Speaking of questions, I think sometimes the most important questions are the ones we ask ourselves. So if our conversation created questions within whoever is listening, that could very well be the start of healing, because
of a new journey.
Most important, exactly, of a new journey.
Yeah. Maybe we could take a moment now and relax our bodies and our minds and free them up and allow that inner space to rise within us. Let that light within rise up within us. If we inhale slowly and deeply through our noses and be aware of any tension in our bodies, consciously release the tension that you've observed by gently softening those muscles. Keep your shoulders and jaws relaxed. Your abdomen should expand and your chest should rise a little. Exhale slowly through your mouth, and as you blow air out, purse your lips slightly and keep your jaw relaxed. You may hear a soft swishing sound as you exhale. So inhale slowly again. Release the tension from your body, from your jaw, from your shoulders, from your hips. Gently soften those muscles. Exhale slowly now through your mouth. As you blow air out, purse your lips slightly and keep your jaw relaxed. You may hear a soft swishing sound as you exhale. So breathe in slowly. Hold your breath. Release again. Breathe out slowly. Pause again. Breathe in slowly. Breathe in the air of freedom, of peace, of joy. Hold your breath. Breathe out slowly. Release the tension. Release the angst. Release the suffering. Try and do this exercise at least twice a day, morning and evening. And I'm reminded, I think her name was Hildegard of Bingen. She said, all will be well. So thank you all for being with us. And thank you, Sunita, especially. It's just been amazing hearing your journey. And I love reading your poetry, as you know. And as a therapist, it puts me in that space with patients, so that I know that as I sit opposite them and keep eye contact going, that there's a fire within that's beginning to burn. And first of all, it just has a little bit of smoke and a bit of anxiety. And then the fire bursts through. And it's freedom. Thank you all.
Can you show us the book? Can you just hold the book
Oh,
up,
okay.
Rose? Yeah, I want to see it. What a fabulous title. I mean, if you can't be naked with yourself, then who can you be naked with?
True.
And it continues. It doesn't end.
Sunita, you are always welcome to our Zoom room.
I'm
Always.
so honored to be in this Zoom
Yeah.
room, you know?
So we will be
so
back next Monday. We actually have a wonderful doctor from Israel who's a TMS doctor. He's amazing.
Okay. Yeah.
And a patient from Israel who's an American. And we're excited to continue. So send your questions and have a wonderful week. Keep finding the gift in Corona.
Well, you know, when you say
This Corona?
I think of that cold beer.
Yeah, me too.
I'm thinking of that beer. And,
Yeah.
but that's one of the issues of staying home. It's like that kitchen stays open. All right, well, a glass of wine, not going to kill me.
And
All
the
right.
fridge.
Go up and down the steps, squats, chair sit, push-ups, sit-ups. Good
I've been
night.
trying, Tovah. Good night.
See you all.
Have a good day, Rose. It was
Thank
my
you.
honor. It was my honor.
Okay.